Well, I just talked about the Wu flu last night, but I was speaking more in terms of the long-term economic problems that are going to be caused by it, and I didn't really give a proper update on the current situation. Because we have some big news now as far as the U.S. is concerned. Up until now, the U.S. has been, really low in terms of its confirmed number of cases, and people like Chris Martenson have been pointing out that the reason for why this is because the CDC, their, guidelines for who they should and should not test are extremely narrow and really outdated. Because at first they were saying, well, you should only test people who have been to China recently. And then, they expanded it to people who've been to China recently or have had contact, of course, with a known Wu flu sufferer, of a known Wu flu patient. But if they couldn't trace back where this could have spread from, well, then they would have no reason to test you. And so, of course, there was no evidence of community spread in the United States because they would not test for anyone who might have gotten this virus indirectly from someone out in the wild in an unknown transmission channel. And so now finally the CDC has expanded their criteria for testing people. And of course it takes a long time to test people because these test kits have to be shipped out from the CDC to a hospital. The hospital has to perform the test, and then they have to ship the test back to the CDC to be analyzed. And so this takes many days. And so now we're getting a few cases of community spread coming out of Washington. Actually where I live here now, we've got two cases in Florida, neither of which do we know yet are from travel related or from community spread. I would assume that they're from community spread because these were people who were not tested until these guidelines were changed. So these are people who were in the hospital for a number of days, showing symptoms, being treated for viral pneumonia, I would presume, who were not tested for the Wu flu until the CDC just went and expanded the testing criterion, and it turns out these folks did have Wu flu. Well, the fact that they weren't tested before shows that they either, one, didn't go to China, and two, didn't have any contact with a known Wu flu patient. So that means these are two cases of community spread. And in that time that these people have been going out and about, they have been, infecting everyone else with the Wu flu because the precautions taken, for someone in the hospital with viral pneumonia are different than, the precautions taken for Wu flu. So now, only now are these people being put under, the proper isolation regime. And who knows how long they were out in their communities, spreading this around when they were asymptomatic. Of course, the serious complication rate for this virus is only something like 15%. So that means that there's probably plenty of people that they could have spread it to who are not going to get sick enough to go into the hospital, and will keep spreading it around. This is the danger of, once you have community spread, and I think it's why the CDC refused to test for it for so long, because they were afraid to know that this is out here, and that they know that the truth is closer to what Scott Gottlieb on CNBC has been saying. Gottlieb, of course, is the former FDA director, so unlike the current FDA director, he's, kind of at liberty to speak openly on television. He doesn't have to run his public statements and public appearances through the office of Mike Pence. And he has, no real reason to shill for the administration and to try and, cover up how bad this is. And so Gottlieb was on CNBC this morning, and he said that the real number in the U.S. right now is probably in the low thousands. And, this will become clear once, now that we've broadened the testing criterion, and now that we're actually going to start testing people, who have this virus. And so then, Gottlieb, the former FDA director, is on TV saying, hey, folks should be prepared. They should stock up on supplies. They need to have whatever they need because, this is going to be a long haul. But don't worry, it's just the sniffles. So you're crazy if you go out and buy a mask, or if you buy some rice and beans or other dried foods that are shelf stable and will be able to get you through, a substantial period of where you can't leave your house and go grocery shopping because your town is quarantined. Of course, I don't think in reality that the U.S. will be able to quarantine towns in the same way that China has. The U.S. just simply doesn't have that kind of control. I think that there would be rebellions against that. You would have, probably roaming bands of koofers out on motorcycles and things, hunting down the cops and trying to break quarantine. And so in reality, the disruptions won't be necessarily from the containment strategy. I think the disruptions will be just from, a breakdown in the now national supply chain, not just international global supply chains, not just the supply chains from China to the U.S., but from, different parts of the U.S. Going across the country. If you'll have a lot of sick truckers, they can't make deliveries. If you have sick mechanics, they can't fix the trucks when they break down. If you have sick gas station attendants, they can't, open the stores so that people can get their fuel. These, I think, are the kinds of disruptions that we'll be seeing here in the U.S., the actual effects from the virus, which may or may not be worse than the quarantines. I'm not quite sure yet. But there's absolutely no doubt in my mind that the United States will not be able to do take half the measures that China has in trying to contain this epidemic. I haven't been out in public yet today, but I'm sure now that they've announced in my area that there's some Wu flu patients at our local hospital, that things will be getting pretty bad around here as far as the stores go. I wouldn't be surprised if in Florida we have a very significant economic disruption just because of people leaving here who are tourists and hear, hey, we've now got the Wu flu here. And so they're going to all go home and flee, hoping not to catch the Wu flu themselves, when in reality, a lot of the elderly people here probably, who are, of course, at the greatest risk, the fatality rate for the elderly is astronomically high. They may or may not already be infected and just asymptomatic. And so a few of these people, most of them will probably be fine, but a few of them, they'll go back to their home states, and they will then become, the typhoid Marys up there. They will be the ones spreading this around. And so I wouldn't be surprised if a sudden exodus from Florida over a fear of the Wu flu here doesn't spread it to, the rest of the country very quickly. All those asymptomatic people going through airports and spreading out across the country, it will not be pretty. And of course, like I said, the economic impact of that here would be pretty significant, because a lot of businesses, in order to prepare for the tourist season here in the winter, they hire extra people, they stay open extra hours, they order a lot more inventory into their stores because there's more people here, there's more consumption going on, and so they have to fill that. And so what we'll probably see here, I would think, if this really does get bad, is layoffs and potentially store closures in the cases in which people, borrowed money to stock up in case of the season, and they were unable to, sell their wares. Essentially, I think that a lot of people who are in, Florida and are involved and are, susceptible to this seasonality of the tourist season, are unhedged. You could kind of analogize what a lot of these people will go through to like a farmer who plants a whole field of grain, and then let's say only half the seeds germinate, but he paid for a whole field of seeds, and he did all the work all season trying to plant them and to grow them and water them and fertilize and everything. He has all that invested, and only half of his expected returns came to fruition. That would be the effect of the tourist season in Florida being cut off at the beginning of March. Now, the Florida Department of Health has been pretty tight-lipped so far about all of this for a while now. They were being quite coy a few weeks ago, saying, because of patient privacy laws, we can't really tell you if anybody here has the Wu flu. Which isn't true, because the privacy law says that, hey, if it's in the public interest, you don't have to reveal the person's identity, but you can tell the rest of the people in the state that, hey, we have this incredibly infectious disease that could kill you. You should know about that. And so it seemed like they were trying to hide things to begin with, but now it seems like they're being a little more open, I guess, because these folks were just tested, and now we're hearing about it. And of course, now there's a second death in Washington, and as Gottlieb said, things under the surface are going to be much worse than most people probably realize right now. And he said by the end of the week, I don't know if I mentioned this, hundreds, he said, will probably be confirmed by the end of the week now that more people are being tested. So, hey, this is kind of, I guess, your last chance. If you don't have enough food, I have plenty of food in the freezer, so as long as we don't lose power, I'll be fine, I know. But for the rest of you out there, if you're the kind of person who goes out and buys your food for the week every Sunday, and that's all you keep in the fridge, go out and buy a couple bags of rice and beans. It's cheap. Buy a can of MSG, and you can make it palatable. Salt and pepper and MSG, you can make almost anything edible. So with that said, if you gain anything of value out of this video, I'd appreciate it if you like this video and subscribe. And so I'll see you folks back here tomorrow.